Director, University Health Services, Dr. Olufemi Akibola, is going to talk to us on that.
The director of the LSA, permit me to stand on the existing protocol. Great right. Great right. Great right. Greatest of the greatest of the greatest. I welcome you to the University of Ibadan. I'm sure if you look up, it will be a nice thing to welcome everybody to the Premier University. And as we move on, we've been sitting for a while. I want us to relax and even relax our facial muscles so that we can smile a little bit. I will be talking on the health challenges as we've witnessed in the last few years from DRC students. And if we look around, we will see that there is a reciprocal relationship between health and academic performance. What I mean by that is, if you are healthy, you are likely to come up with top grades. So that means we want to partner with you to make sure you remain healthy while you are in university. We want to partner with you to make sure that you remain healthy while in the university. One of the major challenges has to do with stress. Obtaining a university degree can be stressful. And most of us will be in a position where we assume we are likely to be responsible for your choices. So we'll be taking choices concerning our health. We'll be taking choices concerning some other issues for the very first time for some of us. And that could be challenging. At the University Health Service, which is Christian Jaja Clinic, I'm sure some of us have been there, is a clinic that is situated along Jaja. University Vice Chancellor has given us the permission to have a semi-autonomous clinic at your center there for the very first time. So by the time you will be resuming, there will be a clinic in place for you. But to access care, we need to identify you. So that means you must be registered. There will be biometric capturing of your data so that nobody will impersonate. It's very, very important. Impersonation is a big crime. And when it comes to medical issues, impersonation can be dangerous. I've been at the center where somebody had to use another person's case file. Unfortunately, the person died. And that prevented the original owner of the case file to use that case file. Because once there is a bad report, that case file is withdrawn. So we try as much as possible to make sure there is no impersonation. There are other reasons, even concerning reactions to drugs. The health team is like any other unit on campus. It's a mini unit that is ready to assist you. Data is captured. Your case file will be retrieved. Then you will now move to the consulting room to see a doctor. Presently, I can assure you the University Health Service has 14 medical officers. There is no university in Nigeria that can beat that number. And not only that, we also have services beyond the primary health care. Most health centers will operate at the primary level. Primary level means all you need to do is complain. If you need admission, you will be pushed elsewhere. But we have tried as much as possible to improve on the number of people on ground and improve on the services. So I will tell you the services that are available presently at the University Health Service. Presently, we realize that there might be difficulties with your vision. And vision is very paramount to reading. So presently we have 3 optometrists who take care of visual defects and they correct visual problems. Not only do we have optometrists, we also have physiotherapists. They call them physical therapists. These are medical personnel that don't even use drugs in treating pains and ailments concerning bones and posture. Most of us will be sitting in front of laptops, desktops, and we know that might cause some postural problems. We have a physical therapist on ground and he will be glad to listen to your complaints. We also have medical social workers. The medical social work unit is an improvement over what we used to have. And for the first time this year we will be taking student volunteers. That's people who are around to give support to those who are ill. And we see students volunteering to stay with people who are ill, to help them and to assist them. They are volunteers, but at the end of their service we give a stipend to appreciate them. And that will go a long way because I can assure you, most of us should start thinking of taking up volunteer services. It goes a long way when you want to get a job. People on panel may ask you, how many volunteer jobs have you done? If you are really interested in taking this job, how far have you gone in helping others, even without pay? So we have medical social workers that can take care of all the situational crisis. Then, how do we get registered? The first and major item has to do with your financial clearance. When we have evidence that you are a qualified student and you pay the medical fee, then you can walk in to the desktop office where your biometric data will be captured by computer operators. Once this is captured, you will be given a hospital number. Please make sure you put this hospital number on your mobile phones. You cannot everywhere, but there might be emergencies. You can easily go through your phone log and get the hospital number. It reduces the waiting time at the emergency room. So make sure you store the hospital number, and once you come and the hospital number is known, your case file will be retrieved and you have access to all medical services available in the University Service. The drugs are free, but we try as much as possible to guide against abuses. So that means if you need a drug, we go the extra leg to make sure we make the drugs available. If you really need the drugs and you don't pay a kobo for getting those drugs. Not only that, if you need care outside the University Health Service, we also run an ambulance service that can easily evacuate people who need urgent attention outside what this health center can provide. This might be to places like UHS and some other tertiary health centers. When we do this, you are expected to get in touch with your guardian, parents, to partner with the health service in picking up the bills. That's the only one that you might need an extra hand. But we make sure we give all the necessary support even while awaiting the arrival of your parents. And we also want to talk on medical correspondences. I know we've been sitting for a while. If there is any reason why you might miss a test or miss a lecture, either because you are ill or you are on admission elsewhere, that means we expect a medical report from that hospital. What we are saying is we are not forcing you to use our facility. We are not making it compulsory that you must always come to our facility. But what we are insisting is wherever you are admitted, we must get the information within 48 hours. That is very, very important. It's important because we don't write retrospective medical reports. I will just explain that and I'll take my seat. Retrospective medical report means somebody missed a test or an exam, maybe in June, and he now walks into the health service in August. That there was a test I missed, there was an exam I couldn't take part in June. Please, I was still during that period. This is a report. That is medicine after death. We don't do that. We want to be in a position where we can assess and confirm the genuineness of whatever report you are giving. So once again, I wish you all good health as you pursue your university education.